Hello, I think we are clear. Yes, I think we are loud and clear. Okay, good morning. This is your wise doctor. Today we are studying the first class. This class will give you a clear cut, transparent way for achieving or obtaining good rank. I can assure you a rank below 1000 in the upcoming Inicet as well as the Neet PG 2024. Trust me, the only thing you have to do is no need to write all sort of notes, bundles and bundles of notes, and no need to just mug up everything. I just want you to sit back, relax and listen the class, and you please just try to understand each and every statement that I speak here. Please don't distract your mind. Don't just make yourself confused and just writing, mugging it up. Don't do all those things. Just listen to the class. Just you listen my words. Just try to understand the concepts. That's it, enough. We will do a lots and lots of MCQs, and trust me, each and every MCQ will be discussed in detail. For example, if there is an MCQ like all of the following are bacteriostatics except, if there is an MCQ like this, obviously we will discuss all the classes which belong to bacteriostatics and all of the classes which belong to bactericidal, and we will discuss in brief which has the maximum bactericidal activity, which has the maximum bacteriostatic activity. Everything, each and every point will be discussed regarding that particular MCQ. So don't feel tensed. I just want you to just sit back, relax and just listen the class, right? Please see, in all of the MBBS, in all the 5.5 years, what we have done is done, right? It's all past. Just leave it off. Don't feel regret, or don't regret for anything, right? My friends got good rank, they were already joined in PG, but I'm just staying like this, doing some sort of PT jobs and getting a little bit of salary. Don't feel like that, right? See, you will get your time. The only thing you have to do is do your work, do your homework, do your job. You just do what you should do. That's it. The rest of the thing is left to the fate, right? Every person will get his day. If he really immensely has done an hard work, obviously every person will have his turn. Just wait for your turn. That's it, right? Don't feel anything like low. Don't feel low. You just be energetic. You just be cool and just study. Just do some work, do some hard work. That's it. You just revise these things. I am ready. I'm here to give you each and every concept which you need in order to achieve a better rank in Inicet as well as Neet PG examination. We will discuss in both patterns. We will discuss the Neet PG pattern, Inicet. See, today there is no big difference between Inicet, Neet PG and even FMGE also, and all the FMGE aspirants who did, I'm sorry to say this, even if you did not secure a good rank, don't feel low, right? Be good, be courageous. You just listen these classes. Let's do it once again. We'll start the game. Once again, right? So be cool, be energized, right? I'm here to boost you. Just leave it off. Just forget everything, right? I'm your wise doctor, and we will walk together, right? So let's begin the class without any delay. We'll just start the first topic. We'll start with the session general pharmacology, right? General pharmacology. See, we will just discuss each and everything, how much it is required for the examination. We will discuss only that. We don't want to go anything beyond that. See, for example, if you are discussing something about receptors, right? If there is something like G protein coupled receptors, we will discuss only what are the examples for G protein coupled receptors and how they act. That's it. We don't want to go into the immense biomolecular pharmacology, or we want to go into the clinical pharmacology like GPCR is a 7-membrane. It's a 7-membrane structure. It will be having the G protein on the cytoplasmic end of the component. We don't want all these things, right? If there is an MCQ about this, then we'll just discuss only the basic molecular things. We don't want to go like it has 7 strands, 7 components, 7 spiral strands, protein structures in which a G protein is binded towards the cytoplasmic side. We don't want all these things, right? We just discuss only things which are needed, right? Okay, without any delay, we'll just go into the class, right? So the first thing is we'll discuss about the pharmacology. In the pharmacology, you just remember, I will tell you some definitions which is very much important that you should remember for sure, right? Because these definitions you will be getting in the examination. Now the first definition is orphan drug. What is an orphan drug? A drug which is used for rare diseases. But what is meant by rare disease? A disease whose incidence is 1 in 5 lakh population. That is called as rare disease. What is a rare disease? A rare disease whose prevalence is something like, or incidence is something like 1 in 5 lakh population. That is coined the term as rare disease. Now the second term is essential drug. What is an essential drug? The name itself denotes, right? Drug which is used by majority of the population. Majority of the population use these drugs. These drugs are coined as essential drugs, and these satisfy the healthcare needs of most of the population, right? So these are essential drugs, right? Essential drugs are something which most of the population uses. Most of the population healthcare needs are fulfilled by these essential drugs. And what are some of the features of these essential drugs? It is a single molecule drug. It is a single molecule. It should be a single molecule drug. It should be safe. It should be affordable. Means, see, the thing which is affordable for most of the population, then only it can be coined as an essential drug. For example, it's a costly, something like if it is 2 lakhs injections. See, some drugs are there, mostly MABs, monoclonal antibodies, right? They are very much costlier. There are something like, there are some injections which cost nearly 11 lakhs, 24 lakhs, 36 lakhs, even 46 lakhs injections is also there. See, those will not be something like, those will not be treated as an essential drugs. They can be treated as a rare or orphan drugs which are used for rare diseases. But what is an essential drug? Which are easily available, easily affordable and cheap, and which are safe and which are single molecule, right? So these are termed as essential drugs. Now third one is prescription drugs. What are prescription drugs? The name itself denotes the drugs which are given only under prescription. And one more thing is, these drugs, these drugs come under Schedule H class. These drugs come under Schedule H class, right? These prescription drugs which are given only under the prescription of a registered medical practitioner, and these drugs are belong to Schedule H class, right? Now spurious drugs. Spurious drugs. What is meant by a spurious drug? A drug which is not producing adequate response. A drug which do not produce adequate response, right? These drugs are called spurious drugs. That means, what is low in spurious drug? The efficacy is low. It has low efficacy. The spurious drugs have low efficacy, right? Because there is no active ingredient, or there is deficit in the active ingredient. There is no, or there is deficiency in the active ingredient, right? You written right? I can erase it, right? Okay. Now what is the next one? Misbranded drugs. Misbranded drugs. What are misbranded drugs, right? What are misbranded drugs? Just 1 minute, right? What are misbranded drugs? These are the drugs which are wrongly labeled. Wrongly labeled. Drugs are called misbranded drugs, wrongly labeled drugs. Low quality of substances, low quality or substandard. They are substandard. Can you give me one example for misbranded drugs? For example, on the strip it is written as 650 mg PCM, but the PCM tablet itself consists of only 250 mgm. So it is a misbranded drug. It is a misbranded drug. The Dolo 650, it should have 650 milligrams of paracetamol, but it has only 250 milligrams of paracetamol. So it is a misbranded drug. Adulterated drug. You heard about adulterated food? The same definition applies for this adulterated drug also. It consists of additional unwanted component. We don't want this, but why the hell it is present? Because it is an adulterated drug and it should not be done because it decreases the efficacy and potency, or it may increase the toxicity of the drug, or it may cause unnecessary things regarding the drug. So adulteration should not be done. If there is a presence of additional unwanted component, then that drug is defined as adulterated drug. Okay, if it consists of additional unwanted component, it's termed as adulterated drug. But how we should use the drug? See, the drug should be used by a patient in a perfect, in a regular, in a prescribed form, in a prescribed use, which is termed as rational drug use. But what is meant by rational drug use? The definition is very much simple. The use of right drug for right disease, for right by right patient at right dose, in right duration, and right through right route, with right dispensation and correct monitoring. That sort of usage of drug is defined as rationalized drug use or rationalized drug use. So just remember one thing. What is meant by rationalized drug use? The usage of, the utilization of right drug, the utilization of right drug for right disease by right patient at right dose, in right duration, in right route, the right dispensation, and through right monitoring. If maintain all these features, then it can be defined as rational drug use. But the MCQ is, what is the MCQ? Which is not included in the rational drug use. Which is not included in the rational drug use. That is right price. Price is not a factor of rational drug use. Right price is not included in rational drug use. Remember this statement. It is very important. It is a potential MCQ in your INICT. You may get a question like all of the given things are factors for rationalized drug use, except the options will be A, right drug, B, right monitoring, C, right route, D, right price. What is the answer? The answer is D, right price. Right price is not a feature, or right price is not a factor for rationalized drug use. You got my point, right? Now you got the drug, you brought to the dispensary, and you also gave it to the patient. Now the patient will take the drug to home and he will start the treatment. But how the drug moves, how the drug acts, how the drug do its job, how will you define it? It can be defined in two aspects. One is called pharmacokinetics and another one is pharmacodynamics. What is meant by pharmacokinetics? Kinetics means movement. So what is moving? The drug is moving. What is moving? The drug is moving in the body, and while the drug is moving in the body is doing some things regarding the drug. What the body does to the drug is defined as pharmacokinetics. The similar opposite thing is pharmacodynamics, means what the drug does to the body. But what will the body do to the drug? The body will take the drug, it will simply absorb, it will distribute the drug to different tissues, and in the tissue the drug will be metabolized, and after the metabolism the drug will be expelled, or something called excretion. So what will the body do? The body will first absorb the drug, so it is absorption. Second, it will distribute the drug to different tissues, so it will do distribution. Third one is the distributed drug will undergo metabolism and it will form different metabolites, so metabolism. And fourth one is, after the functionality of the drug is complete, it should be excreted outside. No, if it's not excreted, it may lead to drug toxicity. So obviously it should be excreted. So the final step is excretion. So what does the pharmacokinetics contain? Absorption, distribution, metabolism, excretion. Absorption, distribution, metabolism, excretion. What does the pharmacodynamics consist of? What is meant by pharmacodynamics? What the drug does to the body. But what will the drug do? The drug will simply convert into a molecule. It will simply convert into a molecule, and this molecule will act on its particular target, and it will do its job. For example, if its job is bactericidal activity, it will do bactericidal. If its job is alpha blocking, it will do alpha blocking. If its job is beta blocking, it will do beta blocking. If its job is immunosuppression, it will do immunosuppression. So what will the drug do? The drug will simply convert into a molecule or a metabolite, and these metabolites will do the job that the drug has to do. For example, alpha blocking, beta blocking, alpha plus beta blocking, immunosuppression, and HT blocking, proton pump inhibition, sodium potassium channel, everything what the job of the drug is, it will do the job. That's it. So pharmacodynamics is what the drug does to the body. Pharmacokinetics is what the body does to the drug. So we'll discuss something about pharmacokinetics. What is meant by pharmacokinetics? It is simply what the body does to the drug. So the first step of what the body does to the drug, right? What will the body do to the drug? In the first step, it will absorb the drug. So the first step is absorption. But how will the drug absorb, right? How will the drug be absorbed by the body? There are different mechanisms, but the most common mechanism that occurs in the body for the absorption of drug is passive diffusion. If there is some term with the word passive, that implies that process will be conducted in the absence of utilization of energy, or there is no utilization of energy. That thing will be considered as passive. But if there is some process that is undertaken in the presence of energy or by the utilization of energy, then that process will be considered as active. So most common mechanism by which the drug gets absorbed in the body is by passive diffusion. That means it occurs in the absence of energy. No energy is being utilized in this process. So that's why it's termed as passive diffusion. But passive diffusion occurs maximum at which state of drug? At ionized state of drug. Unionized state of drug. The drug should be in an unionized form in order to get diffused through the membranes. The passive diffusion occurs maximum when the drug is at a unionized or non-polar state. So the drug should be in an unionized form. If it wants to get diffused through the biological membranes, right? So it should be in a unionized form or a non-polar state, right? Why it should be in an unionized form? Because only if it is in the unionized form only, then only it is lipid soluble. Why it should be lipid soluble? Because the biological cells of the body, most of the cell membranes, they consist of bilipid layer, right? What is the membranes of the cells made up of? Bilipid layer. I think you heard something about phosphobilipid layer. It is termed as, right, bilipid layer because you have two layers of lipid ocean. They seem like ocean, right? And the proteins are floating in between these lipids like icebergs in an ocean, right? So as the biological cell membranes are made up of what? Lipid molecules or a bilipid layer. So the drug should be lipid soluble in order to get transported through these cells, or in order to get diffused through these cell membranes. It should be lipid soluble, and the drug will be lipid soluble only when it is in a unionized state or a non-polar state. But if you ask me, sir, what is meant by unionized state? What is meant by non-polar state? See, the answer is very simple. It is a basic chemistry. If you want to know what is meant by unionized state or non-polar state, if it is noted as a drug, if it is represented like opposite charges present on that opposite poles in an equalized manner, then it is termed as polar. But if the drug is not in this state, then it will be termed as non-polar. Simple as it is, basic chemistry. But we don't want all these things. Simply remember one thing, that is, what is that? The drug should be in an unionized state, then only it is lipid soluble. When it is lipid soluble, then only it can pass through the biological cell membranes. It's as simple as like that, right? So with all this basic functionality concept, we can define that acidic drugs get absorbed maximum in a acidic medium only. Acidic drugs get absorbed maximum in a acidic medium. Now can you tell me where in the body you can see acidic medium, high amounts of acidic nature, high tensile acidic nature? It is in stomach, obviously. Why? Because in stomach what we have? Hydrochloric acid. This acid gives the acidic nature to the stomach, which in turn gives a chance for the acidic drugs to get absorbed in a maximum quantity. So acidic drugs get absorbed, maximum absorption of acidic drugs occur in acidic medium. When it comes to basic drugs absorb maximum in a alkaline medium. Then where we will see the alkaline medium in the body? If you ask me, the answer is simple: duodenum, that is small intestine. Duodenum, that is small intestine. Why it is alkaline? Because it has bile. It's as simple as like that, right? It has bile, right? So maximum absorption of drugs on an average in the whole body takes place at which part of the body? If someone asks you the question, then the answer is small intestine, that is in the duodenum. But why it is maximum, why the maximum absorption of drugs takes place in the small intestine, that is of duodenal part? Because due to large surface area. Simple logic, that's it, simple logic. Now in all these components, which molecules are poorly absorbed? Which molecules are poorly absorbed? Can anyone tell me? Answer: it is proteins. Why proteins are the poorly absorbed molecules? Due to large surface area, or due to their large sized molecules. Sorry, proteins are poorly absorbed because see, I just made it. Due to large molecule size, large molecular size, right? It's not surface area, due to large molecular size. It's as simple as like that. Okay, proteins are poorly absorbed because due to large molecular size, right? Remember this, right? now okay, we took the drug, it goes into the body. Now it will be released into the bloodstream. After the drug intake occurs, you taken the drug, it can be in the oral form or it can be in the IV form, whatever it is, we'll take it as oral form. You drug intake, then it will go into the, where it will go, it will be absorbed into the vascular. But how will the concentrations of the drug they are maintained, or how will the concentrations of the drug gets changed as soon as the drug intake occurs? So there are some patterns in which the drug gets released. There are some patterns, if you ask me, in which the drug gets released, right? There is something like there are different types of releasing patterns in which the drug gets released. But if you ask me what are those patterns, sir, then I will simply say like there are different types of drug releasing patterns, right? I will tell you some aspects, you just listen. Number one is controlled release. Now, how will on the controlled release, what happened to the drug? As soon as the drug is taken inside, the drug goes into the body and the plasma concentration. See, this is the plasma concentration. This is the time. Initially, the concentration of the drug in the plasma increases like a spike, and after some time it gets steady state in a steady concentration. It will maintain a steady concentration. There is one more releasing pattern of drug which is called as sustained release. Sustained means which is maintained. Sustained release. If you ask me what is meant by the sustained release pattern, which is maintained, if you ask me, the drug level slowly rises and after some time slowly it gets depleted. So it's maintained, it's sustained. Now one more thing is conventional release. Now if you ask me one more pattern of release, it is conventional release. So in the conventional release pattern, the drug levels get spiked maximum, but after some time they get depleted in the very same fashion, and after some time the level gets maintained in a steady state. It remains the same almost, right? Now this is called as conventional release. Now one thing is controlled release, if you ask me, and another type of pattern of release is sustained release, and another pattern of release is control release. But if you ask me, what are the advantage of these releases? Why the drug shows different, why we should design these drugs in such a way? There is only one answer for it. This, if you take some patterns like sustained release, like if you just 1 minute, if you just take one pattern, some patterns like sustained release, right? Sustained release, and you take one more pattern, that is controlled release. These two types of drug release patterns into the vascular or into the plasma, what happens is they increase the duration of action. By the release of the drugs into the plasma in these patterns, either in sustained release or in a controlled release pattern, what happens is it increases the duration of action of the drug. Now, in which type of drugs this is helpful? These controlled release or sustained release pattern of drug, in which type of drugs which is helpful? It is helpful in drugs with short half-life. So this type of release pattern, that is sustained release or controlled release, they are beneficial for the drugs with short half-life. They are beneficial in drugs with short half-life, because these drugs, by releasing in these manners, something like in sustained release or in controlled release, what happens is the duration of the drug or the duration of the action of the drug can be increased, right? Now, there are some more drugs called enteric coated drugs. Sorry, I'm getting a little bit serious, but don't fail. Come on, be energized, right? Be energized, right? We will be getting this definition, something like enteric coated. If you take some tablets like aspirin, I think some of your family members who has I'm not saying this wrong, but don't take it as wrong. If some of your people whom you know, if they are affected with a paralysis stroke, if they are affected with a neurological stroke, ultimately sometimes they will be prescribed with this drug called aspirin. This aspirin, sometimes if you look at the back of the strip, it will be given as aspirin, it will be written as aspirin EC, or it will be written as aspirin enteric coated. Why the hell it is enteric coated? Why it should be enteric coated? Because it's simple. Because in order to prevent the drug being metabolized or drug being affected by the acidic nature of stomach, so these drugs are used, this enteric coated form is used in the drugs for making acid labile drugs, so that these drugs will not be affected by the acid present in the stomach. So in which type of drugs this enteric coated will be done? Mostly in proton pump inhibitors. Why? If these proton pump inhibitors, if these drugs are affected by the gastric acid, then what happen? They will be easily be metabolized and their duration of action will be decreased. They will be excreted fast and their duration of action will be decreased. So in order to prevent this, what they do is they will do an enteric coating on the drug. So these drugs are enteric coated such that they will be acid labile drugs. That means they will not be affected by the acid or HCl present in the stomach. So some of the examples are proton pump inhibitors. Now can you tell me some examples for proton pump inhibitors? It's very much simple. Pantoprazole, esomeprazole, lansoprazole, rabeprazole. These are some of the proton pump inhibitors, right? So that is an example for enteric coating. And one more one more use of enteric coating is it is used for the prevention of gastric irritation, because some of the drugs may produce some irritability in the gastric mucosa or in the gastric region. In order to prevent this gastric irritation also, what we do is we will just make the drugs in a enteric coated form. Which drugs cause gastric irritability? Example, aspirin. That's why aspirin, as it causes gastric irritability, it will be coming in a enteric coated form, right? So that this enteric coated form will protect the gastric mucosa from the adverse action of this drug, right? That is the use of enteric coated drugs, right? Now, so we will discuss about absorption, extent and its rate. Extent and rate of absorption. Guys, listen this topic. This is very much important. You will be getting 2 MCQs from this topic. It is sure shot. You may take it INICET, you may take it NEET PG. You will sure shot get 2 MCQs from this topic, right? It's a promise on Sunny Leon, right? It's a promise made on Sunny Leon. You want to become Michael Jackson, you should have passion. You want to become Sachin Tendulkar, you should have passion. You want to become someone like MF Hussain, you should have passion. But if you want to become like Johnny Sins, you must have dedication. It's not passion, you must have dedication, right? So show your dedication in the subject pharmacology. You should become the utmost top and notch product, right? So show your dedication like Johnny Sins, right? So let us start. We'll get back to the topic. Extent and rate of absorption, right? So what is rate of absorption? Can you tell me if any of the term is denoted with a word called rate, then it is related to something called time. Anything you just ask with rate, any word linked with rate, then obviously that X factor is being measured with time, right? Remember this. So if you ask me extent and rate of absorption of drug, what do you mean by these 2 terms? First we'll talk about extent. Extent means how much drug, how much quantized, how much drug is being absorbed, or in other terms, what fraction of unchanged drug reaches the systemic circulation. What fraction of drug reaches the systemic circulation? This is denoted as the extent of drug which is reaching the circulation. What is meant by extent of absorption? Extent of absorption means how much fraction of unchanged drug reaches the systemic circulation, or otherwise it is defined as a term called bioavailability. What is meant by bioavailability? It is the fraction of unchanged drug. Remember my friends, it is the fraction of unchanged drug which is reaching the systemic circulation. Now, how can you measure the extent of absorption or the bioavailability in form of numbers? Then it will be denoted as the extent will be measured from 0 to 1. If the extent of absorption or the bioavailability is 0, then it is least. Then the drug has least or lower bioavailability. But if If the value is 1, then it has maximum bioavailability or highest bioavailability. Now, what is the MCQ here? Can anyone tell me? The potential MCQ is the only route of drug administration, with 100% or with the value 1 of bioavailability is intravenous route. That means the point is very much simple. Only in intravenous route or IV route the drug is 100%, right, or maximum 100% available to the tissues, or 100% of the drug is reaching the systemic circulation in an unchanged form, or its bioavailability value is 1. We already discussed the maximum bioavailability value that you can obtain is 1, or otherwise it can be called as 100% if it is measured in percentage, right? So which route of drug administration will have 100% bioavailability? That is intravenous route. It's as simple as like that. Now this extent or this bioavailability nature of the drug depends on some factors. What factors? Mainly first pass metabolism, right? Can anyone tell me what is first pass metabolism? Anyone tell me? In short, I will explain. As soon as you take the drug through oral, it happens mostly in oral administration of the drug only. In oral intake, as soon as you take the drug through mouth, it goes to stomach. After stomach, it goes to the liver for the first metabolism. This step happens first. Now in the liver, the drug will be metabolized up to some extent. Now this is called as first pass metabolism. Now after this, it will be available for the circulation system. Now if the drug has high first pass metabolism, most of the drug will be metabolized in the liver itself. Now only some amount of the drug will be available for performing its action. Now if the amount of drug available for the action gets decreased, ultimately its efficacy also decreases, right? But if the first pass metabolism occurs in a lower extent, then obviously majority of the drug will be available for the circulation, as well as majority of the drug will be obtaining its action on its target. So obviously the efficacy will be increased. So the first pass metabolism obviously decreases the bioavailability of the drug. So that's why it is taken as the factor which may affect the bioavailability of your drug. Remember this, one of the factor which affects the bioavailability of the drug is which one? First pass metabolism. If the drug has high first pass metabolism, its bioavailability decreases. Remember this, it's very simple concept, no need to complicate it. Now the second one is absorption. Depends on first pass metabolism and absorption, right? Now, if you ask me one thing, for example, this is the concentration, the plasma concentration of drug after the intake of drug. This is plasma concentration. This is time. This is time. Time t. Now, what we discussed in case of IV, what we discussed in case of IV route or intravenous route, it has 100% bioavailability. So as soon as you take the drug in IV, means directly you are injecting into the vein or directly you are injecting the drug into the bloodstream. So obviously the drug will not go to the liver, hence the first pass metabolism will be bypassed. So the drug is directly appearing in the bloodstream. So it is appearing in the bloodstream 100% in an unchanged fraction. So as soon as we inject the drug through intravenous access into the vein, it will show 100% bioavailability. But as the time goes on, slowly the plasma concentration of the drug gets decreased. But why it is decreasing? Because it gets converted into its respective metabolites, and after some point of time these metabolites get excreted. So obviously the plasma concentration of the drug gets decreased because excretion of the drug metabolites is going on. So as the time goes on, the plasma concentration of the drug decreases. Whereas in case of oral intake, if you are taking the drug orally through mouth, through oral cavity, the drug slowly gets increased in the plasma. The concentration of the drug slowly increases. After achieving a maximum concentration, slowly the drug's metabolites are formed and they starts to excrete outside. Then the plasma concentration of the drug slowly decreases. Right? So this happens in case of oral. This happens in case of oral intake of drug, and this one happens in case of IV intake of drug. Now you got two graphs, right? Now the area present under this graph, this area which is present under the curve, is denoted as area under curve of intravenous axis, area under curve of IV. Remember this. Now this area which is present under this yellow color curve, or the oral administration of the drug, the curve which has been obtained when the oral administration of the drug is done, this area under this curve, remember this, area, right? This area is termed as area under curve of oral. Right? Now, after getting the two things in one stream, we injected the drug through vein. In another process, we just given the drug through oral intake or through oral cavity. Now, if you want to know the bioavailability of this drug, you can simply get the bioavailability of the drug by dividing area under curve of the drug when given through oral intake by area under curve, which is obtained in IV, through IV access. So AUC of oral by AUC of IV. What is meant by AUC? This area under curve. This area present under curve is determined as AUC. So if you want to know the bioavailability of that particular drug, for example, the drug X, if it is given in IV and it is given in oral, and you obtain two curves, and the area present under that respected curve is determined as AUC, and if you want to know the bioavailability of that X drug, then you can simply get it by just doing this area under curve oral by area under curve intravenous into 100. You will get the bioavailability percent of the respective drug. You got it? Now we will discuss something about rate of absorption. We'll discuss something about rate of absorption. Sorry if I'm don't using the colors frequently, but my request is I just want to use only black color, but if it's really needed I will use colors, right? Don't think like that. Don't think like Sir is the wise doctor is not using colors at all. No, I will use the colors, but please stay with me, okay? Now we'll just define the rate of absorption. What is the rate of absorption? Sorry. Just define the rate of absorption. If there is a word, if it appears in the question with a name or with the word rate, then obviously you are defining some factor with respect to time. What are you referring here with respect to time? It is the concentration of drug with respect to time. T. Concentration C. Now, as soon as you given the drug, just 1 minute, please. Just 1 minute. Yes. As soon as you are given the drug, what happens is slowly the concentration, the plasma concentration of the drug increases, and it goes to a point, and after that point slowly you have something called plasma half-life, right? After the completion of plasma half-life, what starts? I think you know it. What starts? Slowly the plasma concentration of the drug starts to deplete because the excretion of the drug starts. So slowly the concentration of the drug decreases and it comes to a dead end position, right? Now this point where the maximum concentration of the drug is seen. Here is the maximum concentration, plasma concentration of the drug can be obtained. This is called as Cmax. So this is the maximum plasma concentration of the drug that can be obtained. Now the point of time at which the maximum concentration of the drug is obtained, the point of time at which the maximum concentration of the drug is obtained, this is called as Tmax, right? So the maximum concentration obtained, the maximum plasma concentration of the drug that is obtained is Cmax, and the maximum concentration of the drug which is obtained at a particular time, the time at which the maximum concentration of the drug in the plasma is obtained, that's called as Tmax, right? Now if you ask me what is the particular marker, what is the particular marker for, or what is the particular marker that determines the rate of absorption, what is that marker? It's Tmax. Remember guys, the factor or the particular marker which determines the rate of absorption is Tmax. It is a very, very important MCQ. Tmax. Okay? I got it right? Okay. Now, I will ask you one question, right? It's simple, it's easy. I will just ask you one question, right? You have, you have 4 drugs, and these are their curves. These are their curves. You have 4 drugs, namely A, B, C, D. And these are the respective curves which are obtained when taken concentration of the drug against time. Now, can you tell me which has the faster rate of absorption? Right? Now, can you tell me? Now, Tmax is the time taken for obtaining maximum concentration. Now, if the time taken for obtaining the peak concentration is less, then obviously its rate of absorption is more. You got my point, right? I think you can understand my concept. If the time required for a particular drug to achieve its maximum concentration is low, if the time required for a particular drug to achieve its maximum concentration is low, then obviously it has fast or higher rate of absorption. You got it? For example, I think some people might get confused. There are 4 friends. You listen this. There are 4 friends, right? Friends are A, B, C, D. A can eat 10 jalebis in 10 minutes. B can eat 10 jalebis in 20 minutes. C can eat 10 jalebis in 30 minutes. D can eat 10 jalebis in 40 minutes. So, who has fast eating capacity, fast absorbing capacity? Who has fast eating or absorbing capacity? Obviously A, because he can eat 10 jalebis in 10 minutes. That means his gut is absorbing more amount of food in least possible time. So, he has fast absorption, fast rate of absorption, followed by B, followed by C, followed by D. Now you got my point, right? Now you got my point. So, same thing applies to this. Now, A drug has fast rate of absorption into the bloodstream, followed by B, followed by C, followed by D. Now, if you ask me, assemble these 4 drugs in the order of their rate of absorption, drug A has more rate of absorption than B, then C, then D. You got my point? You got the concept? We can go to the next thing? Yes. Okay. Now, we will discuss something about PGP, plasma glycoprotein. I think we can stop here. It's okay for you, or we'll continue? It's already 1 hour. So I think it's better we'll stop here. Okay. We will discuss the following topics in the next class, right? We will discuss about P glycoprotein, plasma glycoprotein. Then we'll discuss about pharmacokinetics. See, general pharmacology, why I am taking this much time? Because there is a reason. You will get sure shot 2 MCQs from general pharmacology. It might be a little bit shorter class, but still you will get 2 MCQs for sure, right? You will get something efficacy, right? For example, efficacy is the maximum action a drug can produce. This is called as efficacy. A maximum action the drug can exhibit, that is called as efficacy. Potency means the least amount of dose that is required by a drug to exhibit its action. The least amount of dose to exhibit its action. For example, if you ask me, sir, I am unable to understand this potency, please tell me with an example. Okay, I will tell you with an example, right? For example, there is person A, person B. For person A, if he wants to prepare for an examination instantaneously, he needs only 1 month of preparation. But for B, if he wants to prepare for a particular examination instantaneously, he needs at least 2 months of preparation. So, this person A is more potent than person B. You got my point? You got my point? Person A, he can prepare for the examination just within 1 month only. But person B, he needs at least 2 months for preparing for a particular examination. So, person A is more potent, he has more caliber, he has more potency to prepare for examination when compared with B. So, the same thing, if a drug is the least amount of drug which is needed to exhibit its action, it is called as potency. For example, there are 2 drugs from a same class. For example, lidocaine. Lidocaine is a local anesthetic, and prilocaine. Lidocaine and prilocaine. If you ask me, lidocaine just 0.2 milligram is needed to exhibit action. It's for example only, right? Don't take it like that. If you take lidocaine, if lidocaine requires only 0.2 milligrams to exhibit its action, and prilocaine requires only 0.1 milligram to exhibit its action. Now, which is more potent? Can anyone? Obviously, prilocaine. Prilocaine is more potent. Why prilocaine is more potent? Because the dosage required for prilocaine is less than the dosage required by the lidocaine to exhibit their respective action. Because prilocaine requires only 0.1 mg to initiate its action or to exhibit its action, but lidocaine requires 0.2 mg to exhibit its action. So obviously prilocaine is more potent than lidocaine. Now can you tell me what is the side effect of lidocaine? Anyone? Tremors, muscle tremors. Sometimes it may lead to coma also. Even prilocaine has those complications, but lidocaine is the most safe drug. In all of the local anesthetics, it is the most safe drug, right? Okay. With this we will end the class. We will meet in the next class. Until then, sit back, relax, you revise the topics which I have explained today, and just meet me as soon as possible. Signing off, your wise doctor. Thank you very much. Mula.